Welcome everyone to the launch of Canada's first ever World Breastfeeding Trends Initiative, or WBTi. This is a milestone moment. Canada is now joining over 100 countries that have used the WBTi to measure, evaluate, and strengthen infant and young child feeding policies and programs. I am Dr. Laurie Twells, a professor and associate dean in the Faculty of Medicine at Memorial University, and a co-lead of the WBTi Core Team. I will be the host for today's seminar. I'm going to move myself over to the middle here now, just to make sure I'm in everybody's center. Okay, that's better. Thank you. This is our roadmap for today, starting with a welcome and some context. Then we'll be having a land acknowledgement and introducing our core team. Talk a little bit about some of the global and Canada's breastfeeding statistics, and then do an introduction to the framework for the WBTi and answer any questions and talk a little bit about next steps. Just in terms of a little bit of housekeeping, a lot of the housekeeping items will be in the chat. So regarding translation to French, for example, the details and instructions will be placed in the chat for you to have a look at. We will be recording the presentation. Questions and answers at the end won't be recorded, but if you put questions in the chat, we'll try and get to them during the webinar time period, and if not, we'll be actually trying to answer questions later at a later date on our webpage as well. I'll just give people a few minutes to look at the chat to work out some of the translation processes if needed. Perfect. I'll let others let me know if anything else needs to be addressed at this point in time, but I'll carry on. So welcome and thank you all for being here. Our goal today is quite simple, and that is to launch the WBTi process in Canada. We also want to engage partners from across Canada, so this is also a call for engagement. We know that you are here because you want to ensure that every child born in Canada gets the best start for life. We'd like to start our session today with a land acknowledgement. I'll pass it over to our Indigenous lead, Stephanie.
Yeah. We begin by acknowledging that we are on the traditional territory of Indigenous peoples on Turtle Island, the original stewards of this land. A true land acknowledgement must go beyond speaking of history. It must also acknowledge the ongoing harms enacted upon these communities. We must confront the painful truth that genocidal government policies, among others, deliberately targeted the health and survival of Indigenous families. By forcibly severing connections to traditional nurturing wisdom and first foods, removing birth from the land, and forcing birthing parents out of their own communities into a location unfamiliar to them, these racist policies created cycles of trauma, malnutrition, and loss that continue to impact birthing, infant feeding, and communities' health today. The generational harm caused by aggressive formula promotion, especially in communities without clean water, and the very high price of food was not an accident. It was a tool of subjugation. This legacy is a living truth, and its effects are still felt. Today, the harm continues through inadequate regulation, the unfettered marketing of breast milk substitutes, and healthcare systems that too often threaten and coerce through child apprehension or forced sterilizations rather than support. The dependency governments created by their policies carry a responsibility to repair. So we call on all governments, healthcare institutions, and policymakers to honor international commitments, immediately live up to the minimum standards for infant and maternal health that Canada has endorsed for over 40 years. Restore self-determination, fulfill the obligations of the UNDRIP, the TRC, and the MMIWG report by funding community-led health services, including training of Indigenous IBCLCs, Indigenous midwifery, and parenting programs, which are written and taught by each community. End predatory practices. Stop the unchecked corporate influence and marketing that mislead parents and threaten the health of infants, the parents, and the community. Empower, not impose. Replace coercive policies with genuine support, ensuring Indigenous parents have the resources, information, and safety to make informed choices for their children. A land acknowledgement is not just words about the past. It is a commitment to justice in the present. So honor the past by protecting the future.
Thank you, Stephanie, for that important and powerful land acknowledgement, especially during the week of National Breastfeeding Week in Canada. So, time to get going. The first thing we'd like to do is introduce the WBTi Core Team. I've already introduced myself as Dr. Laurie Twells at Memorial University. I'm one of the co-leads of the WBTi Canada team, and I've been doing research around infant feeding, nutrition practices, maternity practices for 25 years now. I'm going to hand it over to our next co-lead, Elizabeth Sturkin.
Thank you, Laurie. Yeah, my name is Elizabeth Sturkin, and I'm a nutritionist by profession, and I represent INFACT Canada and the International Baby Food Action Network. And as the director of INFACT Canada, we've done numerous BFHI and code trainings across Canada, numerous code monitoring reports, and breastfeeding action packs on breastfeeding support and protection for World Breastfeeding Week, which wonderfully commences today. As representative of the International Baby Food Action Network, I am proud to say that the WBTi is a global infant program to monitor and score breastfeeding supports at national level. As well as the infant representative, I'm the delegate responsible for our submissions and representation at the Codex Alimentarius, which is the UN FAO WHO body that sets standards for food products and formulas, etc. And we attend and submit on the standardization of formulas and baby foods to ensure that the code and the global strategy for infant and young child feeding is integrated into the baby food standards and formulas for adoption at national level, which includes adoption for Canada, which we hope we can advocate for with the WBTi. Thank you.
Thank you, Elizabeth. Gulpia, please.
Thank you, Laurie. Hello, everyone. My name is Gulpia Ugur. I'm a medical doctor in training and also hold both masters and PhDs in public health. Currently, I'm teaching in the Division of Population Health and Applied Health Sciences at the Faculty of Medicine in Memorial University, Newfoundland. My main research area is maternal and child health, and with the focus on early childhood nutrition and breastfeeding practices. I'm especially interested in how actually policies and programs can better support mothers and children to improve long-term health outcomes. So this is not only a professional interest to me, it's also a personal passion. So I'm truly excited to contribute to this important project and be part of this amazing team. Thank you so much.
Thank you, Gulpia. Haley?
Hi, welcome everybody. My name is Haley. I'm a registered dietitian with my master's of public health. I'm also one of the board of directors for the Breastfeeding Committee of Canada, and will be representing the BCC and the WBTi Core Team. I also work in public health practice and support infant and young child feeding and early years nutrition in my day-to-day work. And I am particularly interested in inequities related to infant and young child feeding and how our policies and programs can reduce those over time.
Thank you. Isabelle.
Hi, my name is Isabelle Michaud-Letourneau. I'm a nutritionist or a registered dietitian from Quebec, in Quebec in Canada. In fact, I have worked for the last 20 years in international nutrition. I represent the Quebec breastfeeding movement, le Mouvement Allaitement du Québec, and I'm an adjunct professor at the University of Montreal. Thank you.
Thank you. Jennifer.
Hi, I'm Jennifer Abbas-Dick. I'm an associate professor at the Ontario Tech University. I research breastfeeding. I'm also a registered nurse and an IBCLC. My research focuses on co-parent in breastfeeding, co-parent support, e-health, implementation to standardize breastfeeding education. And I'm also involved with the Canadian Breastfeeding Research Network.
Thank you, Jennifer. Jen?
Good morning. I'm Jen Pedalston of Chestermere, Alberta. I'm a retired pharmacist and IBCLC who in my later years of work specialized in international co-training. I've been a La Leche leader proudly since 1980. I look forward to using my research, search, and advocacy skills around breastfeeding to complete this assessment and, more importantly, use those results to improve breastfeeding duration rates in Canada, influencing both federal and provincial government to further the importance of breastfeeding for the health of all Canadians.
Thank you, Jen. Stephanie.
Shkali, everybody. My name is Stephanie George. I am Oneida Turtle Clan from Six Nations. I am a trained Indigenous midwife at the Six Nations Birthing Center. I am a lactation consultant. I teach at McMaster University in health, Indigenous health and Indigenous health research. And I'm also now a master's student studying health science education.
Thank you. And we've got one of our supports here, Claire.
Hi, everyone. I'm Claire. I'm an undergraduate student studying developmental psychology in the Faculty of Science at Memorial University. I've been working with Dr. Twells and this core team for the last few months, and I'm very excited to be brought on to help with this project.
Thank you, Claire. And our coordinator as well, Zoe Healy, wasn't able to make it today. She's a medical student and has classes. Right, well, thanks for those introductions, and we'll get started. So in 2003, the WHO and UNICEF launched the Global Strategy for Infant and Young Child Feeding. This was a culmination of a number of initiatives and reports that really came to the forefront with this sort of global interest in the fact that breastfeeding rates globally were starting to decrease. And there were a number of initiatives that needed to be launched to actually sort of get the global environment working again. So the Infant for Young Child Feeding strategy was launched. The aim was to improve through optimal feeding, nutritional status, growth and development, and the health and survival of infants and young children. It built on a number of past initiatives, the Innocenti Declarations of 1990 and 2005, the Baby Friendly Hospital Initiative, which many of us will be very familiar with in Canada, and of course the International Code of Marketing of Breast Milk Substitutes and its relevant World Health Assembly resolutions. This launch addressed the needs of children in difficult circumstances as well, with the focus on infants and mothers living with HIV, low birth weight infants, and infants in emergency situations. The World Breastfeeding Trends Initiative really came out of the infant and young child feeding strategy. It was launched in 2004 and is a national assessment of policies and programs. It's developed to help countries assess progress in actually implementing the global strategy for infant and young child feeding. It's based on the WHO's assessment tool. The WBTi measures the strengths and weaknesses of 10 policies and programs and 5 infant feeding practices. It's managed by the Global Secretariat of the Breastfeeding Promotion Network of India, a member of IBFAN, which oversees the global data repository. So the WBTi connects directly with a number of global reports. Many of us in this space will be very familiar with the Lancet series on breastfeeding in 2016 and again in 2023, both with slightly different focuses. In 2016, the focus was primarily on cost-effective interventions for public health, which of course included breastfeeding as the main cost-effective intervention that countries can invest in. In 2023, their major focus was on the commercial milk formula industry and the negative impact it's actually having on the infant and child nutrition feeding ecosystem. The WBTi also aligns with other reports and other initiatives at a global level. Of course, the Code, as we've already spoken about, and the Global Breastfeeding Collective as well. So in terms of some of the global breastfeeding statistics and goals, overall, and this was reported in the 2016 Lancet series, about 38% of infants 0 to 16 months are exclusively fed. Because of this reduction in terms of not meeting the global recommendations for 6 months to exclusive breastfeeding, this contributes to almost 11.6% of child mortality in children under 5 years of age. And annually, it's about over 800,000 deaths. From the perspective of the targets at the global perspective, the World Health Assembly identified a global target of exclusive breastfeeding to 50% by 2025. And at this point in time, about 48% have achieved exclusive breastfeeding to 6 months. The Global Breastfeeding Collective, which includes the WHO, UNICEF, and 20 other partners, has a goal of actually exclusive breastfeeding to 6 months at 70% by 2030. So really the WBTi is a call to action for countries to join a process of monitoring and evaluating their own breastfeeding programs and policies that support the recommendations to exclusively breastfeed for 6 months, with breastfeeding up to and over 2 years at any point in time. In terms of what's happening globally that's been reported in the Global Breastfeeding Collective, as you can see, there's been some progress made. When you look at this map, the colors that are mostly green are showing small increases in breastfeeding rates, exclusive breastfeeding to 6 months. One of the things you'll notice here is that there's limited data here when it comes to high-income countries. So, for example, Canada does not feature in this report, neither does the UK, Australia, Europe, or some of the Scandinavian countries. So there's a gap in some of the high-income countries actually reporting on their own statistics around protecting, promoting, and supporting breastfeeding. When you actually look at this from a visual perspective, you can see the targets here on the figure on the left, with the WHA target to 50% for 2025 and the Global Breastfeeding Collective to 70% exclusive breastfeeding at 6 months in 2030. We're a long way off that in Canada, and even though there's been some progress made globally, what's happening in some of the high-income countries is not yet been reported well. So when we move to Canada, and we're looking at data that's relatively old now, most people in the country will know that most of the data that we actually use is some of our Canadian Community Health Survey data from 2017, 2018. But what's interesting here to note is that over a vast majority of people in Canada, or mothers in Canada, want to breastfeed. So the average initiation rate is over 90%. So 9 out of 10 mothers initiate breastfeeding. But what's interesting as well to note is that we do have some quite dramatic regional variations across the country. Some from a low of 69.8 in Nunavut to a high of 99.4 in the Yukon. When it comes to duration, about 1 in 3 mothers on average breastfeed to 6 months. But what this graph also shows, using the same data, is that the initial drop-off is very dramatic in that first month. So although we have a high percentage of mothers who start breastfeeding, in the first month we see quite a dramatic drop-off where exclusive breastfeeding continues to 6 months at 1 in 3, while there's still any breastfeeding until 6 months, but not exclusive breastfeeding. The other thing that's interesting to note in Canada is that we do have some quite regional variations in exclusive breastfeeding. So despite the fact that the average breastfeeding rate is 1 in 3, when we actually look across the country regarding provinces and territories, we see quite a range from 21 to 39. And again, just highlighting the countries from the perspective of the minimum to the maximum when it comes to duration. The lowest rate is in Nunavut at 21% exclusive breastfeeding to 6 months, and in British Columbia, 39.1%. So well off the targets for the Global Breastfeeding Collective of 70%. We have a long way to go here in Canada. So when it comes to the WBTi, as we said, this is a global initiative. It's run out of the Breastfeeding Promotion for Network in India. These are the two and have been the two global leads for helping to develop this tool, administer this tool, provide training to countries around completing a WBTi assessment. And some people in this space will be very familiar with these two leads, Dr. Arun Gupta and Dr. Nupur Bidla, who actually would have attended today, but in fact are in India, and they have a special India celebration today. Otherwise, they would have actually been here as well. So this is just really showing you that there's a number of tools available on the website. So it's a tool that's been available for over 2 decades now. And over 100 countries have actually completed a WBTi assessment, including a number of countries who've completed several WBTi assessments as well. So the key objectives of the WBTi are to guide governments to close gaps in infant and young child feeding practices and policies, to provide advocacy and greater investment in breastfeeding and infant and young child feeding, and to promote child nutrition, survival, and women's health through better feeding practices. They're the overall objectives. The way the WBTi framework works is completed through several steps. So I'll just run through these very quickly. Step 1 is obviously to identify the national coordination when regards to the co-leads and then the core team formation and training. There's then the process of the data collection and analysis in step 1. So at this point in time, at this launch, we have national coordination. Myself and Elizabeth Sturkin are the co-leads of WBTi Canada, and we have put together a core team who you've just met. One of the requirements to do the WBTi in your own country is to actually take part in training. We took part in 2 days of training led by Dr. Bidla a few months ago. And as you can see here, you're really covering off the sort of, how a WBTi is actually conducted, the sort of guidance when it comes to regionalization and disparities within a country, the focus on the fact that it's very much a consensus building exercise, as well as a call to action for engagement. One of the things that we learned from the training in particular was that the report is one piece of this whole process, whereby the engagement is critical because the tool is meant to be used as a call for action for our policy and decision makers to actually work with us together to improve our rates of breastfeeding and early infant and child nutrition. We'll be moving forward with the process of data collection and analysis over the next number of months and be putting together a report. This report is then coded and scored and then verified and by the global group in India, whereby a report card will be produced and then published on their global repository website. So just to get into a little bit more detail so people can understand what the process is, the WBTi assesses 10 policies and programs and 5 infant feeding indicators. So as you can see here, there are 10 policies and programs. So I won't read them all out, but the first one would be the national policy of governance and funding, whether an actual country has a national policy. Number 2 would be looking at the baby-friendly hospital initiative and whether how many actual facilities are designated BFI friendly. Number 3, of course, we're looking at the code. We then move into things around maternity protection, infant feeding during emergencies, monitoring and evaluation in a consistent, unbiased, and regular way is number 10. In terms of part 2, we're looking at indicators. These are going to be very much more data related. So they will come from some national surveys done by Statistics Canada, other surveys and research that's done across the provinces and territories, as well as some of our regional health authorities will actually publish some of this research as well. So these are our data pieces that actually show us and give us a snapshot of actually what is happening in our country. So whether it's the timely initiation of breastfeeding within 1 hour of birth, our exclusive breastfeeding rates to 6 months, our median duration of breastfeeding, percentage of babies being bottle fed, and then when complementary feeding or the complementary feeding and introduction of solid, semi-solid, or soft foods after 6 months. So when it comes to how this process unfolds, this is just going to be a little snapshot to show you the sort of process and the amount of work that will have to go into this process as well. So if we just use number one as an example, where we're actually evaluating whether our country has a national policy and what the governance and funding is for supporting, protecting breastfeeding, what you'll see is that there'll be a number of questions that will have to be answered under each indicator. Each indicator will be scored out of 10, and you can see it's a sort of traffic light system to show you where you are from the perspective of how well you're doing. And then they will be accumulated to have a score out of 100. So for example, for the first question on whether our country has a national policy, there will be a number of specific questions that you can see here, and I've just highlighted a couple to show you how things are scored. So on the column with the numbers, you can see these are the potential maximum scores you can achieve if these things are in place. Now, bearing in mind that in Canada, this is going to be a difficult task, despite the fact that it's difficult in other countries as well, because we have to report on a Canadian report card, but we also, of course, have our 10 provinces and 3 territories. So each province and territory will receive its own report card, which will then be sort of culminated, and through consensus, we will have to report on a Canadian score. So you can imagine that the score itself will not be representative of every country, of every province or territory. It will have to represent the country in general. That will be the report on the global repository, but each province and territory will have its own report as well. So you can see here under this particular question around governance and national strategies, one of the questions would be whether your country has a national plan of action developed based on a federal policy, which would score 2 points, or 1.7, the National Breastfeeding Committee links effectively with all other sectors like health, nutrition, information, etc. And that would give you a score of 0.5. So this scoring system then gets added together to give you an overall score. Now, just to bear in mind that there's often a lot more information than is always relevant or even accessible just through these questions. So the actual report itself includes a lot of open-ended questions. It allows for investigation, interviews, focus groups, clarification around what's available and what's not. So the score itself, despite the fact that the score will be a sort of the key score that's actually published, there will be a lot of other information available to help us justify or clarify that score. When it comes to infant feeding practices, so we have 5 infant feeding indicators. These are now scored as a percentage within a population actually achieving those things. So for example, on initiation of breastfeeding within 1 hour, we'll be reporting on an average or a range of scores around the percentage that happens in our facilities across the country. And so this is, again, like I said, the data piece where some of this data will really require a lot of investigation and a number of people to help glean all this data from the provinces and territories, because some of it will be published in-house rather than Statistics Canada data or any of our national survey data. This will require a little bit more legwork. When it comes to the full process, what you can see here is just the sort of process and how things will work over time. So as it stands right now, we have our core group formulated, and we're really just starting to move forward with this collection of information and assessments. I suspect, and our core team probably would agree, that this process in itself is likely to take us upwards towards a year to actually collect all the information, analyze it, put it together in some sort of report. In addition to that, we'll be engaging partners right across the country from the perspective of interpreting the data, as well as providing justification and clarification for some of the scores that we actually put together. The report is meant to be a call for action and engagement exercise, so that will be a critical piece, which is probably why it will take so long. But once the report is actually published, it then gets verified by the Global Secretariat as well. And so there's a verification process of sources and information that we have provided in this report. So just to show you a little bit, and I know it's not a perfect slide, but just to sort of show you how that process works when it comes to the verification process, we will be providing our findings in a table regarding to all our indicators and programs and policies. We'll be looking at gaps, which will require some qualitative data as well as probably information from interviews or focus groups that we hold. We'll be providing some recommendations as to how to move forward based on the gaps, and also the sources of information so that they can be verified by the Global Secretariat in India. This is the way the information is displayed. On the website itself, the WBTi website, there's a lot of information for a lot of different countries. It's certainly worth looking at. This is just a demonstration or an illustration of data that's come from Bangladesh on the right in terms of their report card, but just to also show you some of the global rankings when it comes to the scores that get published. So as you can see, the top 5 countries that have actually conducted WBTIs in terms of their scores are Bangladesh with 91.5, Sri Lanka, Afghanistan, Cuba, and the Gambia. And then countries at the bottom of this list at the moment, as you can see here, Paraguay, Germany, Australia, Cape Verde, and Libya. The United States' latest report that was published is a score of 40.5 out of 100. And as you can see here in terms of the table, this is that Bangladesh is the country that's actually repeated the WBTI several times. Their overall score in 2021 was 91.5, and you can see this score has increased over time based on an evaluation of programs and policies. So they are actually doing a very good job at a call to action, engaging their policymakers and decision makers in this area, so that in fact their score has increased quite dramatically over time. One of the things that the WBTI recommends is that assessments are done on a regular basis. So as you can imagine, a snapshot of any one country at any one point in time is useful information, but almost more useful is the fact that you're responding to those gaps, you're responding to recommendations, and when you do another report 2 to 3 years later, what you can then see is some improvements as well. During our training in the summer, we are actually fortunate enough to have Helen Gray, who led the UK WBTI report last year. They launched their report with big fanfare in the United Kingdom. It was a country that covered 4 countries, England, Wales, Scotland, and Northern Ireland. So again, a little bit like Canada in the sense that it had to deal with different countries, and then put a UK report together as well. Their overall score was 46.5 out of 100. So they also have a long way to go when it comes to improving their policies and programs that protect, promote, and support breastfeeding in their country as well. But I just wanted to highlight a couple of the recommendations and gaps that came from their report as well. So they've suggested their governments must address the baby blind spot in national policies. So the lack of any mention of infants and young children in emergency planning. There are gaps in maternity protection at work for mothers. There is poor and inconsistent data collection across their country. They struggle similar to Canada in a way with just national surveys that are not repeated regularly and do not actually provide the data that's needed. And England lacks any national infant feeding strategy or leadership. So one of the things that's interesting in that report is that among the 4 countries, England actually does worse than Wales, Scotland, and Northern Ireland when it comes to scores. So their overall score is 46.5, but there are some differences in scores across the 4 countries. And England, in fact, is doing less well than some of the other countries. Helen attended some of our training in the summer and spoke to us about the process and how they moved forward with it in the United Kingdom, and it gave us a lot of guidance and advice onto how to engage with the partners as well as complete the assessment and move forward. This was our core team getting together last summer to start to plan the launch and put together a plan going forward for our data collection. So we met here in St. John's, Newfoundland for several days, which was great. This is a team of people who had never met in person before, maybe apart from a couple of us who crossed paths over the years with the work that we all do. So it was very exciting for us to all to get together and get to know each other, because we'll be working closely together for the next couple of years, as well as actually to have a working meeting where, in fact, we've made plans for how we plan to conduct the WBTI in Canada. And as you know, this is our launch. This is the start of everything. And we're delighted that so many people have shown up and are here today to get to know a little bit more about the assessment and potentially help with the process as well. I'm going to hand this over now to one of our other core team members just to speak a little bit about just this overall summary piece, and then we'll just move on to some questions. Thank you.
Thank you very much, Laurie. So I think for the WBTi, it's helpful to think of the WBTi as an umbrella initiative. It's kind of a structure under which many of us are working on infant and young child feeding, in nutrition, perinatal health. You know, the 5 indicators related to feeding provide a snapshot of the situation in Canada, and this provides a lot of important information for advocacy. In terms of the 10 indicators focus on programs and policies, it gave us a common framework to unite us in terms of working together under a shared umbrella. We can give it the color that we want. For example, there are many of people here working on the baby-friendly initiative. So the WBTi can help advance this work. It's an important program. It can also strengthen advocacy for the International Code of Marketing of Breast Milk Substitute, and many of us are also trying to achieve progress on this. It supports efforts to highlight the importance of infant and child feeding in emergencies, IYCFE, and the preparedness that must be in place. It also reinforced the importance of maternity protection. While in Canada, we're fortunate to have a strong maternity leaves, not all workers enjoy equal access of coverage. There are many people here that are attending today that are also working on community-based support group, which plays a very important role with family. So I think I like the umbrella initiative, because if we can work together, we can really give it the color that reflects our unique context in Canada, but also the diversity. So in Quebec, for example, and the province, I will be, I'm sorry, I'm losing my voice. I'll be facilitating the process for the region of Quebec, but also I want to welcome any other French speaker who would like to also engage. You can be in another province, but you just need to communicate with us. It's really a call for engagement, because many of you are working within other initiative, but can really fit under this umbrella. So I really welcome you to really engage with this process. There will be also Stephanie that will be leading the process with First Nations, Inuit and Métis communities to ensure their voice are heard, and others who can join. So I welcome you to get in touch with us and try to engage as much as you can. We'd love to hear from you. You can go ahead.
Thank you. Thanks, Isabel. Yes, so that brings us to the end of our presentation. I hope we've covered some information that's useful. People understand the process. You are now aware of who the core team are. As Isabel said, we're very much interested in partnership and engaging with people across Canada to do this assessment. And we're extremely excited that we finally come to the table to actually do a WBTi assessment. So thank you very much. I will leave that slide here for a second, and I think we'll open it up to questions. And Haley, I know you're going to moderate the questions, whether they're in the chat or if anybody online has a question, please go for it. Thank you.